Oftentimes we come across sayings like, in order to get betrayed, it takes one to trust. The devil you know is better than the angel you don't know. Not all that glitters is gold. And more often than not, we find ourselves in situations that remind us of these. From a simple warm interaction with a stranger to a bitter fallout with a loved one we've known for years. A luminous presence with a cactus touch. An angelic face with a venomous mouth. In summary, not all is what it seems. Such is the reality of the world we inhabit. A nightmare when such kind of a being roams the halls and rooms of a healthcare facility. Nursing and midwifery occupation carries a halo, a title of savior and comforter. Thus, when your body seems to have a mind of its own, gripped by pain, discomfort, weakness, desperation, vulnerability, all you want is for this medicine-armed stranger to make it all go away. But what happens when your thought to be redeemer turns out to be a torturous captor? Such is the case for many who have suffered at the hands of those who were meant to make it all better. A place of sanctuary morphing into a house of horrors. A woman losing her child or her life because a midwife thought her dramatic in her cries for help. A man's simple sickness turning into a life-threatening condition because nobody cared enough to run the proper tests. A couple being publicly scolded and accused of being HIV positive because of their sickly child. An elderly person humiliated, shamed because they couldn't make it in time to relieve themselves in a proper manner. Painting a few scenarios trending, especially amongst the grassroots. Being kicked when you're down. One might ask, who then is responsible for the devils that hide in angels' worksuits? This is where we introduce General Nursing Council of Zambia, a statutory body established in 1970 under the Nurses and Midwives Act No. 55 of 1970, which was revoked and replaced by Act No. 31 of 1997, providing the establishment of private practice, polished the duties of the council, and inflated the scope of practice for nurses and midwives. It was renamed Nursing and Midwifery Council of Zambia, established by the Nurses and Midwives Act No. 10 of 2019. Its core mandate being to regulate the education and training of student nurses and midwives, and to further regulate the professional conduct and practice of all nurses and midwives practicing in the Republic of Zambia. It is an individual practitioner's responsibility to acquire a copy of the Professional Conduct and Disciplinary Code from the establishment, as well as to ensure it is read and the obligations placed on one through this document is understood. It is also an employer's responsibility to acquire a copy of the document, to ensure it is understood by all nurses, midwives, and stakeholders, including the provision of an enabling environment for nurses and midwives to uphold the Professional Conduct and Disciplinary Code, as well as to ensure they have in place a mechanism for implementing the said code and conduct. It is through this conduct and code that consumer rights are to be respected in the delivery of care. Any breach to this warrants disciplinary action being taken against the offender, as outlined in the disciplinary code. There are 3 terms used under the penalty section, and these are caution, censure, and erasure. Caution. This is basically just a warning to mark that the behavior was unacceptable and must not happen again. It is the least serious of sanctions in that it is the least restrictive. Offenses that fall under this include failure or refusal to refer appropriate practitioner on time, failure or refusal to adequately assess and or observe the patient, delegating to unqualified personnel, practicing without a license, negligence in the giving of prescribed drug treatments, abuse of patients mentally, violation of patients' clients' rights, failure or refusing to offer professional assistance to a patient, offer of and acceptance of bribes and other favors, assigning nursing and or midwifery duties to patients and or supporting persons who have no ability or knowledge and skills to perform such duties. Censure. This means to strongly criticize. It is a formal written reprimand by the Board of Nursing for a violation of the Nurse Practice Act. Offenses under this include nepotism, exerting one's influence to favor a category of people, use of cell phones and or earpiece while attending to clients, failure to take care of patient's property resulting into loss, giving improper explanation to a patient relating to an operation procedure. Last but not least, erasure. Synonyms include obliteration, deletion, rubbing, crossing, wiping out. This is simply the removal of all traces of something. Acts punishable by erasure include drunkenness on duty, abuse of patients physically or sexually, registration by fraud, forging any document purporting to be a nurse and or midwifery professional certificate, theft of hospital property, and any other theft. If you have a complaint against a registered nurse or midwife in Zambia, you can make a complaint in writing to the Nursing and Midwifery Council of Zambia or in person as a walk-in client. Your report could save a life.
Things you should know but you probably don't.